If you have diabetes, it is essential that you look at your feet every day and conduct a brief examination at least. This is because minor problems like scratches can become infections. Infections can lead to an infection of the whole foot, and that could lead to hospital admission. If that doesn't resolve very quickly, that can actually result in amputation. If you cannot check your own feet, and it may not be possible because you simply cannot see the bottom of the foot, for example, then you could use a mirror. And you can buy these mirrors or just use a mirror at home, or you could ask a member of your family maybe to look at the bottom of your foot on a regular basis.
I know the risks I run if I don't look after my feet, so I look after them very carefully. I wash my feet regularly and always remember to dry them, especially in between the toes, and we don't get any soggy areas that can become infected.
All you do is see whether you can feel yourself touching your various toes on both your feet just using your index finger. That's all you need to do. And you should easily be able to feel a light touch. If you cannot, that can indicate early nerve damage. And it's very important that you pick that up, then report that to your doctor or your nurse.
I'm looking for cracks in the skin or red areas, maybe the shoes have rubbed a little bit. The cracks in the heel can be quite difficult to get them better, and when you use medication on them, you need to be careful that you're using things that are good for people with diabetes. Some of them can be quite strong and maybe do more harm than good, so check before you put foot lotion on, but remember to use it when you need it.
In relation to looking after your own feet, there are several aspects of care that you need to be aware of. First of all, you must wear comfortable shoes. If shoes are tight, they're very likely to damage the skin and result in infection and even ulceration. So shoes must be of a good quality so that the weight of the body is distributed evenly around the foot and there is no significant pressure around a particular small part of the foot. It is also important to have good quality socks, because if your socks have seams that are too prominent, they can bite into the skin and that can result in damage to the skin. You also need to make sure that you avoid treading on sharp objects. So for example, when you go to the beach, it's very important that you don't walk barefooted. And that is for several reasons. First of all, you cannot risk damage from the sand and stones and shell and other things that are on the beach, but also you may even get heat damage if the sand is too hot.
You know, make sure you haven't got long nails, because that can cut into your toes, especially if you've got smaller toes, which can tend to curl under.
When you examine your own feet, you should be looking out for some common features that can indicate early problems with the foot. And these are going to be a foot that is too hot, a foot that is too cold, a foot that is swollen, a foot that is misshapen. And clearly you need to look out for any breaks in the skin. And these could just be cuts and abrasions or distinct ulcers. When it comes to corns or callus formation, it's tempting to start removing it yourself at home. Do not use sharp blades. Make sure that you get professional advice on how to deal with callus formation, because if you use a sharp object, it's very easy for the foot to become infected. Other features of the foot that you must look out for are redness and pain. However, if you think that you have any foot problem, so that's numbness, an infection, a break in the skin, swelling, or even the foot becoming a different shape, as it were, you must seek advice more urgently. And this can be done via your general practitioner, your nurse, or your podiatrist.